Okay. Welcome everyone to another episode of PhysioTV quiz. We are now on episode 2. Last time we had met you guys on the 21st of August 2021. That was our first episode of this venture. Last time, let's give you just a quick recap of what exactly happened. So we had 4 teams with us in episode 1. DY Patil College of Physiotherapy, Pimpri, MGM School of Physiotherapy, Aurangabad, Ramaya Medical College, Bangalore, and Sancheti Institute College of Physiotherapy, Pune. And if you guys remember, in episode 1, we had eliminated 2 teams, and the ones who went ahead were DY Patil College of Physiotherapy, Pimpri, and Sancheti College of Physiotherapy, Pune. So once again, we congratulate the teams who have made it through so far. And in today's episode, that is episode 2, there are 5 teams with us who will battle it out, and let's see who goes through beyond this to episode 3. I welcome everyone once again, and I hand over the session to our quiz master for the day, Dr. Nikita, Assistant Professor at Sancheti College of Physiotherapy, Pune. Over to you, ma'am.
Hello again, everyone. So it's really nice to have you all. So as just Dr. Rayas told you about the highlights of the first episode of PhysioTV quiz hosted by Sancheti College of Physiotherapy, Pune. Hopefully all of you have settled well. Make sure you have a stable connectivity. Do you have?
Yes, ma'am.
Yes. Okay. So is it the same with team B?
Yes, ma'am.
Okay. So before we go ahead, make sure all of you are visible. Make sure the phone is stabilized at one point. Okay. So you will be getting 15 seconds after the question is read out. You'll be getting 15 seconds to answer. Is that clear?
Yes, ma'am.
Yes. So if the answer was wrong or if it was more than 15 seconds you have taken to answer, the answer will be considered null and the question is not passed down to the next team. Okay.
Yes, ma'am.
So we'll begin right now. Hopefully you guys are able to see the screen.
Yes, ma'am.
All of you?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, good. Okay, so again, before we begin, remember you either win or you learn. So here, going to the next episode, the episode 2 of Sancheti College of Physiotherapy presents PhysioTV Quiz 2021. Okay, so before we begin, we'll revise the teams that we have now. So team A is Srimad Rajchandra College of Physiotherapy, Surat. Team B is Goa Medical College, Panjan. Team C is CMC College of Physiotherapy, Ludhiana. Team D is Banarsi Das Chandiwala Institute of Physiotherapy, New Delhi. Team E is Mahatma Gandhi College of Physiotherapy, Ahmedabad. Okay, we are going ahead with it then. Okay, so we have 3 rounds. The first round is going to be trivia. The second is audiovisual. And the third is back to basics. So for, as mentioned earlier, for trivia, each team will receive a set of questions. So the questions will be given out first for one team and then we move on to the next team. When the question is read out, you have 15 seconds to answer for each question. Okay. Only one team will be answering at one time, so everyone else will be on mute. So the correct response or the correct answer will be graded as 1 point. The incorrect response or if the time is up, you will be receiving 0 points. So as said earlier, no questions will be passed to the next team. So ready, team A?
Yes, ma'am.
Yes, make sure you are unmuted and we'll go ahead now.
Okay.
Ready, set, and go. Okay. Housemaid's knee refers to inflammation of dash. Your time starts now. Clock is ticking. You have 3 seconds, 2, 1, and time's up. So the answer is prepatellar bursitis because it is going to be on the weight bearing side. It causes a lot of inflammation and hence it's called the housemaid's knee. Okay, it's okay. You gain 0 points for this question. We'll go ahead. Okay, the next question. Apraxia occurs as a result of lesion to which region of the brain? Your time starts now.
Cerebellum.
Okay, sorry, that's the wrong answer. It is the lesion to the frontal lobe of the brain. Okay, so you gain 0 points from this question. It's okay, we'll go ahead next. Okay, the next question is, during postural drainage, which bronchopulmonary segment is drained along with the lingula? Your time starts now. Clock is ticking. You have 4 seconds left. 3, 2, and 1. Okay, so you could not answer. We'll still go ahead with the answer ourselves. So it is the medial segment of the right middle lobe. Okay, so you gain 0 points from this. No issues. You still have last question to go. Okay, so how much distance is marked on the floor while performing timed up and go test? Your time starts now.
3 meters.
Okay, good. That's the right answer. It's 3 meters. Thank you, Team A. So your total score of this round is going to be 1 point. Okay, so mute yourself, and Team B, we go ahead with you next.
Excuse me, ma'am. Are we visible? Excuse me, ma'am.
Yes, Team B, we can see you, but I can see only one of you.
Okay, now can you see all of us?
Yes.
Yeah.
Okay, Team B, here we go. So the first question is, Hill-Sachs lesion is seen in which bone? Your time starts now.
Femur. Femur bone. Femur.
Sorry, that's the wrong answer. The answer is the humeral head, which is responsible for dislocation of the shoulder. Okay, so you gain 0 points from this question. Next question, Wernicke's area is present in which lobe? Your time starts now.
Parietal lobe.
Sorry, that's the wrong answer. It is the left temporal lobe. You gain 0 points from this question. No problem. We have more questions coming up. Okay, the next question is, sinoatrial node commonly receives blood supply from which artery? Your time starts now. The clock is ticking, guys.
Hello. Common carotid artery.
Sorry, that's the wrong answer. It's the right coronary artery. Sorry, it's the right coronary artery. Okay, no problem. You gain 0 points from this question. We'll go ahead. Which level of prevention focuses on disability limitation and disability prevention? Your time
Tertiary.
starts now.
Tertiary.
Tertiary. Yes, that's the right answer. Good, Team B. So you have 1 point from this trivia round. Okay. You can mute yourself and we go ahead with Team C. Team C, you're ready? Unmute yourself and make sure you're visible. Yes, Team C, you're visible. We'll go ahead. Ready? Yes, we go ahead. The first question, name the type of amputation at the end of ankle joint in which the heel fat pad is still preserved. Your time starts now.
Show parts amputation.
Can you repeat?
Show parts amputation.
Sorry, that's the wrong answer. The right answer is signs amputation, in which the heel fat pad is still preserved and is going to be a weight bearing part. Okay, very commonly done in the children. Okay, no problem. You have 0 points from this question. We'll go ahead. So subacute cord degeneration occurs as a result of deficiency of which dietary component? Your time starts now.
Vitamin B12.
Yes, that's the right answer. It's vitamin B12. Good. You gain 1 point from this question. We'll be going ahead for the next one. What is the formula for respiratory exchange ratio? Your time starts now. Come on, guys. The clock is ticking. Okay, time up. So the answer is carbon dioxide produced divided by oxygen consumed. Okay, no problem. You gain 0 points from this question. We'll go ahead. Okay. Excess fat in the abdominal region is referred to as which type of obesity? Your time starts now. Team C. Your clock is ticking. The time's up. So it is called as the android type of obesity. Okay. So team C has gained 1 point from trivia round. Thank you, team C. We'll be going ahead with team D. Team D, are you ready?
Yes, ma'am. Can you hear us?
We can hear you and most of you are visible. Okay, so team D, here we go. Loss of muscle mass and reduction in muscle strength as a result of aging is called
muscle atrophy.
Sorry, that's the wrong answer. The answer is sarcopenia.
Sarcopenia.
Muscle wasting. Muscle wasting.
Okay, so the answer is sarcopenia.
Sarcopenia.
Huh? Sarcopenia.
Next question.
Guys, you're visible and audible. Okay. Okay, we go ahead with the next question. The condition called as neuralgia.
Nerve of thigh, lateral cutaneous nerve of thigh.
Okay, I know you guys are very active. You could have waited till we finish the question. Okay, no problem. It is the lateral cutaneous nerve of thigh or the lateral cutaneous nerve of femoral nerve. Okay. Okay, you have gained 1 point from this question, team B. We go ahead with the next question. Cyanosis, that is bluish discoloration, is seen when concentration of deoxyhemoglobin is greater than.
Numerical.
Can one of you answer?
एक ही को बोलना है सिर्फ discussion. Twenty mg per deciliter. Pressure थोड़ी 20 mg deciliter.
Okay, that's the wrong answer. It's 5 grams per deciliter.
5 grams per deciliter.
Okay, going to the next question. Which surgical incision is commonly
Pannenstein's surgical
Okay, team
incision.
D, you're really charged today. Okay, so that's the right answer. You'll be gaining 1 point from this question. Yes. So for the trivia round, team D, you have 2 points. Great going. So thank you, team D. We'll be going with team E now. Team E, are you ready?
Yes.
Yes, we'll be beginning right away. Yeah. So here's the first question. Positive Kernick sign is indicative of. Your time starts now. Positive Kernick sign is indicative of. So the time's up. The right answer is the right answer is meningitis. Okay, We'll go ahead with the next question. You have gained 0 points from this question. Okay. On auscultation, forceps are heard over the right interscapular area. Which bronchopulmonary area is affected? Come on, team E. Clock is ticking.
Medial.
Okay, the time's up. That's not the right answer. It is the right apicobasal lobe. Right apicobasal lower lobe. Okay, so you have gained 0 points from this question. We'll go ahead. Mobilization with large amplitude movement at the end of the range into tissue resistance with rhythmic oscillation is dash type or dash grade of mobilization. Mobilization with large
Grade
amplitude. Sorry, can't hear you.
Grade 2.
Grade 2. That's the wrong answer. It's grade 3 mobilization of Maitland. Okay, going ahead. Yes. How much percentage of disability is required to avail benefits for the disabled people provided by Government of India? Your time starts now.
%80.
Sorry, that's the wrong answer. The answer is 40% of disability is approved to avail benefits from the Government of India. Okay, so the team E has scored 0 points from this round. No problem, we have many more rounds coming up. Just a minute. Okay, thank you. So I'll just revise the scores that we had last time for the first round, that is the trivia round. Team A is at 1, Team B, C is altogether at 1, Team D is at 2, and Team E is at 0. It's okay, Team E, we still have 2 more rounds to go. Okay, so we'll begin with the quiz again. So we just revised on the scores that we had for the first round, that is trivia. So going towards the second round, this is the AV round. You'll be either shown a set of a short video or image in which you have to answer the question. You have 15 seconds to answer after the question is asked. Only one team will answer at one time, so hoping the others will be on mute as in the first round. The correct response will have 1 point. Incorrect response or time up is going to have 0 points, and these questions will not be passed on to the next team. Okay, make sure one of you make sure when the team is answering, one of you discuss and then relay the answer to us. Okay, hopefully we can see the team A. Is team A ready?
Yes, ma'am.
Okay, here we go, team A. Identify the deformity in the above image. Your time starts now.
Polydactyly.
Very good. Very good. That's the right answer. It's polydactyly. Okay. Going towards the next question. Identify the incision in the given image. Your time starts now. Team A. Are you there?
Oblique.
Oblique incision.
Oblique.
Yes, we know it's the oblique incision. We want the name of the incision. Okay, so the time's up. You were halfway there. The right answer is Kocher's subcostal incision. Okay, so you have 1 point from this round. Okay, going ahead with team B. Team A, you can mute yourself.
Ma'am, can you hear us?
Yes, we can hear
Ma'am,
you.
can you hear us? Excuse me, ma'am. Are we audible? Are we audible?
Yes, team B, you're audible. We can hear you. Okay, here we go to the next question. Okay, identify the implant in the above image. Your time starts now. Clock is ticking, team B. You have 3, 2, 1, and time up. Okay, so you could not answer. The implant is seen here is called the reverse shoulder arthroplasty implant. As you can see, the concave and the convex surfaces have been reversed in the joint. Okay, so you gain 0 points from this question. It's okay. We'll go ahead to the next one. Presence of vesicles is a classic feature of which depth of burns? Your time starts now. Clock is ticking, time, team B.
Second degree. Depth. Deep. Deep. burns.
Sorry, time's up, and that's not the right answer. The right answer is superficial partial thickness burns. You can see the formation of the vesicles, very commonly known as the blisters. Okay. So team B is at 0 points at the end of this round. We'll go with the next. Team C, are you ready?
Yes, ma'am.
Yes. So here we go. Identify the image given. What do you see from the image?
Ma'am, is it counter mutation?
No, dear, that's the wrong answer. The answer is Bryant's triangle. As you can see, the imaginary line from ASIS to the glenohumeral, the femoral head. So all 3 lines are going to measure the Bryant. So it is normally called as the Bryant's triangle. Okay. No problem, team C. We have the next question for you. Identify the electrical component given in the image. Your time starts now.
Transformer.
Can you repeat the answer?
Transformer.
No, that's the wrong answer. The answer is a variable capacitor. Very commonly you see in shortwave diathermy modality. Okay. Okay. So team C is at 0 at the end of AV round. We'll go ahead with team D.
We are
Team
audible,
D.
ma'am.
Yes, you're audible and visible. We'll go ahead. So I would request team D to listen to the entire question before you answer. We know you're charged up and you want to say the answer.
Actually, we have only one speaker, so that is why there is some coordination problem. Only I can listen and I have to convey to them. That's
okay. So you still have 15 seconds after you have heard the question. So make sure you hear the question properly and then relate to them. Okay. Identify the deformity in the above image.
Dupuytren's contracture.
Yes, it can also be called as the Dupuytren's contracture. Yes, very commonly seen in ulnar nerve.
Yes, ma'am.
Ulnar nerve injury. Yes. So that is 1 point. Here we go with the next. What is the medical term used for the above?
Malar rash, ma'am.
No, that's not the right answer. Okay,
Classic butterfly rash.
That's not the. That's not the right answer. The answer is xanthoma. So basically, it is the fatty deposition that you see around the eyes, on the nasal side of the eyes. Okay, so team D. Okay, team D. Are you clear with the question? It's called xanthoma.
Yes, ma'am.
Yes. Okay. Going ahead with team E. Are you ready?
Yes, ma'am.
Sorry. Yes. Identify the abnormal waves shown in this EMG report. Your time starts now. Come on, team E. The clock is ticking.
SS. Q wave.
So the time's up. It's an EMG report. Very rarely you'll find a Q wave there. Okay, so it is called a positive sharp wave. Okay. Going ahead with the next question. Identify the given yoga pose. Your time starts now. The clock is ticking, team E. The time's
Superman
up.
pose. Superman pose.
Okay, so this is a yoga pose which we specified. Okay, so the yoga pose is called Naukasan. Okay, so okay, so you gain 0 points from this question. Okay, so at round 2, the team A is at 1, team D is at 1, team E, B, and C are at 0. No problem, we'll have more questions coming up. Okay, so coming back to the round 3, back to basics. Again, we'll revise with the same instructions again. Each team receives 1 question from each kinesiotherapy and electrotherapy. You have 15 seconds to answer. One team will answer at a time. Others will be on mute. Correct answer or correct response is going to give you 1 point for that question. Incorrect response or time up is going to give you 0. No questions will be passed on. Are we ready, everyone?
Yes, ma'am.
Okay, going ahead. Team A, unmute yourself and hope you're ready.
Yes, ma'am.
Okay, so the question for the back to basics round is?
Lewis Hunting reaction.
Lewis Hunting reaction.
Oh, I agree. You are very enthusiastic about it. You could have waited till I finish the question. Okay, I'm going to say the question anyway. The phenomenon of alternating with of cold is called as Lewis Hunting reaction.
Yes, ma'am.
Okay, it's the Lewis Hunting reaction. Okay, so you gain 1 point for this question. Going ahead with the next one. Ober's test is used to detect shortening of which structure? Your time starts now.
Quadriceps muscles.
Okay, that's the wrong answer. The right answer is tensor fascia lata or the iliotibial band. Okay, so for team A for round 3 is at 1 point. Okay, good team A. We'll be going with the next one. Team B, are you ready?
Can you hear us, ma'am?
Yes, we can hear you.
Yeah.
Yes, team B. So here we go. Which muscle is responsible for the unlocking of the knee joint? Your time starts now.
Semitendinosus.
Team B.
Semitendinosus.
Okay, that's the wrong answer. The right answer is popliteus. Okay. Okay, we are going ahead. Okay, we are going ahead with the next question. By using varying current which rises and falls suddenly, you are trying to avoid which phenomenon? Your time starts now.
Shock phenomenon.
Your time is up.
Shock phenomenon.
No, the right answer is nerve accommodation. By varying the current which rises and falls suddenly, we are trying to avoid the nerve accommodation here. Okay, so by the end of round 3, team B is at 0. Team C, are you ready?
Yes, ma'am.
Okay, good. Okay, your first question is, in Laura Mitchell type of relaxation, which physiological principle is used? Your time starts now.
Ma'am, reciprocal relaxation.
Can you repeat the answer?
Ma'am, reciprocal type of relaxation.
Reciprocal type of relaxation. Okay. Okay, you're almost there. It is called as the reciprocal inhibition, which is used in Laura Mitchell type of relaxation. Okay. You have 1 point for this question. Going ahead with the next one. A painful stimulation of sensory nerves caused by flow, cessation, or variation of the current in the passing current through the body is called as dash.
Shock.
Yes,
Ma'am, shock.
yes, team C, that's the right answer. It's called the electrical shock. Good. Okay, so team C is at 2 points at the end of this round. We go ahead with team D. Team D, are you there?
Yes, ma'am. Are we audible?
Yes, you're audible. Okay, so again, listen to the whole question and then we go ahead. Okay. The first question is number of steps.
Cadence.
You guys are too charged up, okay? Okay. I'll still go ahead with the question anyway. The number of steps per time is called as cadence, and that's the right answer. You gain 1 point. Okay, the next question is, within 4 to 5 hours or after exposure to UV radiation, the skin becomes very red and the skin peels in thick sheets.
Last dose
Which
hota hai.
dose is it?
E4 dose.
Okay, the latent period is 4 to 5 hours. I would go with E3. So again, it's a wrong answer. So I would go with E3. Okay. Thank you, Team D. We are at 1 point for you at the end of Back to Basics round. Team E, are you ready?
Yes, ma'am.
Okay, here we go. The first question is, which order lever is mechanically inefficient? Your time starts now. Team E, the time is ticking.
Third order.
Yes, so you did it at the end of the time. Yes, so it is the third order lever.
Thank God.
Yes, so going ahead with the next question. What is the unit of capacitance?
Unit capacitance.
Your time is ticking.
Coulomb?
Okay, sorry. That's the wrong answer. The right answer is farads. So the capacitance is measured in E. So at the end of Back to Basics, you have 1 point. Sorry guys, there's been a clarification. So the above image given, which was answered by team B as Dupuytren's contracture, is not a Dupuytren's contracture. It is a Benedict's hand or ulnar claw hand. Okay, so you'll be getting 0 points for this. Very sorry for it. Okay, so we'll go with the final scores now. So guys, here are the final scores. So team A, C and D are at 3 points. A total of 3 points for the whole of the episode today. And team B and E are at score 1 each. So this is going to qualify team A, C and D to the next round. And sorry team B and team E, but we really enjoyed having you guys. Yes, so the qualifying teams are Banarsidass Chandiwala Institute of Physiotherapy, New Delhi, College of Physiotherapy, CMC Ludhiana, Punjab. Team A, that was Srimad Rajchandra College of Physiotherapy, Surat. Congratulations guys, hope to see you in the next episode. Sorry team B, which was from Goa Medical College, and team E, that is Mahatma Gandhi Physiotherapy College, Ahmedabad. So it was really nice playing with you guys. Hopefully you'll come back in the season 2. And so the episode 3 is going to be on Saturday, that is 28th August 2021, and the time will be relayed very soon on your groups and to your colleges as well. Thank you everyone, and congratulations to the qualifying teams.
Excuse me, ma'am, can we leave?